Hello. Are you suffering with chronic illness with symptoms that other doctors that you've been to have not been able to provide you the relief from these symptoms? My name is Dr. Lonnie Herman, and you're going to hear from this lovely patient of mine. Her name is Elizabeth. In just a moment, you're going to hear from her how she tells you that her body, her life is like night and day. The difference that she's experienced after just 2 visits with me, 2 treatments that she followed that we customized from very unique type of exams that I provided her and unique treatments that I provided her. So in just a moment, you're going to hear her tell you about the incredible results, the relief of certain inflammatory symptoms with rheumatoid arthritis, with lymphatic problems, breast pain, physical pain. You'll hear more about that in just a moment. Then when I come back into this video, I'm going to share with you how I do what I do, what I found with her in my unique exam process. And then at the end of the video, I'm going to make you a free offer. And the goal is to help you get better, to become a patient here in my clinic and help you get better. Let's take a break for just a moment, hear what Elizabeth has to say, and I'll be right back. The way you're feeling now compared to what it was before you started with me is what?
Like night and day.
Night and day. And that's a good thing.
Yes.
Okay. The severity of the RA pain that you had in your body and in your hands, 0 to 10, if 10 is the worst, what would you rate it before you started with me with the RA pain?
Probably at an 8.
Mm-hmm. And now, what would you call it?
I honestly don't think I have RA arthritis pain anymore.
And the nodules in the fingers?
The nodules are gone.
They disappeared completely?
Yeah. I had this lymph pain on my left side, significantly on my left side.
And this was right underneath the breast?
Right underneath the breast armpit area for years, more than 5 years, maybe 10 years. Over the past year or 2, it's gotten significantly worse. Just lots of pain every single day, and the mass was gone.
Instantly?
Instantly.
Mm-hmm.
And it hasn't been back since. I have not had pain. Nope.
It's gone.
Gone.
Pretty incredible.
Yep.
Cold hands and cold feet. That was going on throughout the year?
Yeah.
Okay. And how many years did you have that for?
Really my whole life, but
whole life, even since like childhood?
Yeah.
Okay.
But severely in the last few years.
Mm-hmm.
Just cold feet all the time. I couldn't even get them warm with a heating pad.
Mm-hmm. And now?
And now it's fine.
There's fine, meaning there is no more cold.
There's no more.
All right, isn't that incredible? Her life is night and day compared to what it was before she came to my clinic. She heard me on a podcast online and gave it a chance, and gave me a chance, gave her a chance with my work, and the results are nothing short of impressive. Nodules in her fingers from rheumatoid arthritis condition, gone. The cold hands and feet, even living in warm weather, gone. The armpit and breast pain from a lymph problem that she thought was, which I'll tell you what I found in a few minutes, that pain is gone, and more. So the pain helmet that she described, a crushing type of head pain that was constant for years, it's gone. I'm going to get into telling you what I found with her in my unique exam process. As I mentioned earlier, I'm going to tell you about some of the process that I'm doing here, and then a free offer right at the end, and give you the opportunity to become a patient here in my clinic. All right. So in the first exam I found with her, which was back in September of 2021, today, by the way, is October 20th of 2022. I found first in her first exam of September of 21, the follow-up exam with her was just a few months later. She followed her customized protocol at home, very simple to follow. Her next exam was in February of 2022. So that was about 5 months after her first exam with me. In her first examination, I performed, part of the exam was my emotional type of examination. And I'll tell you about myself in just a moment, but the emotional examination is really important to understand how certain emotions, if in that person emotions are actually driving some of their disease process. I'll show you pictures right here next to me of a researcher. His name is Dr. Masaru Emoto, and he proved that the energy, even speaking to water or thinking certain emotions to water, whether it was I love myself or love or peace or tranquility or hate or evil you'll see the different images here of what the exact same sample of water appeared like under a microscope after he thought and or spoke an emotion to the water. And understand, your body is made of water, right? You have to be hydrated. Every single cell in your body, your skin, your hair, your thyroid, your heart, your bones, your lymph, your muscles, your organs, every part of your body has to stay hydrated with water. And when he proved that the emotion can actually change the water structure, and that water is in your body, just how devastating can it be that you have certain previous emotional traumas or emotional scars? There are some people I've met who have terrible pains in their body that have helped them relieve with my work. Their pain was connected to an emotion. They were molested as a child, or their husband cheated on them, or the wife cheated on them, or they were bullied in school and they regret they have a self-esteem problem. They have regrets that they never took care of themselves. And so there's people who have had family members who never listened to them about their advice they wanted to give them about their own health, and the family member died from a heart attack or died from cancer or something else. So there's a lot of different emotional traumas or scars that can exist in a person's body. She had them. I won't get into her specific details about which we worked with, but in that first exam, we dealt with emotions. Now, you can look at a page on my website. There will be a link to this emotional page below this video, but also we're going to show you right now some images of my emotional impact examination page on my website. And also, I'll tell you right now, we're going to get into a few minutes into discovering about food sensitivities, or as people call food allergies. And I'll relate the food to the stress in the person's body, the inflammatory process that can lead to rheumatoid arthritis, or trigger or inflame the arthritic symptoms, or the cold hands and cold feet symptoms, or the lymph problem. Foods are not the problem. Foods trigger the infections that are living in the organs. That's what causes the problem. The food can trigger an Epstein-Barr virus that's in your brain, or a mold that's in your stomach, and make you feel different symptoms. So I've created a very deep and thorough type of food sensitivity examination. We have a page on my website about that as well. And then there's also a dental examination through, at this point, we're probably about 12 or 13 years into research and working with different dentists, biological dentists, and understanding that certain teeth in the person's mouth, there can be infections in the teeth, whether it's a root canal or it's from a so-called silver mercury filling or amalgam filling, or an area where there could be an abscess in the jaw underneath the tooth looks fine, but the abscess we discovered, and the abscess infected jawbone, was traveling through blood vessels and nerves to the brain and the body. The teeth may show that the body is minerally deficient. So there's a very unique exam process. You can look at this page here about my unique dental exam to get a better understanding of the type of in-depth type of process that I'm doing here in my type of examinations that I perform for people to help them get better. So Miss Elizabeth is night and day in her life. And I'll tell you, in the first examination, what I found with her was her stomach and the whole body are connected. Her stomach had infection from Salmonella bacteria. Her stomach had the epidural chemical that was used with her from almost 2 decades ago when she had gone through childbirth. She had dental anesthesia chemicals from previous dental procedures that were stressing her stomach, mold and multiple different mycotoxins or mold toxins stressing her stomach. Her lymph nodes, when she talked about the lymph pain and armpit pain and breast pain, which has totally disappeared now. The lymph nodes had the epidural chemical. The lymph nodes had multiple candida, fungal infections. Her lymph nodes were loaded with oxalates, which can be gained from certain foods that we're consuming, like tomatoes, for example. And we can get more into that in another time to discuss that. Her whole lymphatic system was loaded with and backed up and stressed by all the epidural chemical. Her kidneys had the epidural chemical. Her kidneys had Epstein-Barr virus stressing them. Her thyroid had dental anesthesia chemicals. Her lungs had mold in them. Her intestines had parasitic infection. Her amygdala, the fear, panic, anxiety part of the brain, had candida. She had activated mast cells in her capillaries of the whole body. She had activated mast cells affecting her whole central nervous system, activated mast cells affecting her spleen, her brain, and in her bloodstream. And she also had Clostridium bacteria that was affecting her kidneys. And there were a few other infections that we found. We don't have to get into every single detail of what we found in that first exam: arsenic, mercury in the kidneys. So she followed a very unique followed a very unique protocol That was in a length of 115 days. And I waited to see her again from the time that she came to me for the first exam. I waited to see her again until February. So that was about 5 months later. And in her follow-up consultation with me, pre-examination discussion actually that we had, some of the symptoms had decreased, some of them still remained the same. And at that point, there was still some inflammation in her body. Now again, before I tell you the findings of her second examination, what I discovered in her, I'll tell you again, I'll remind you what she said, and you're going to hear her whole testimonial at the end of this video. The cold hands and feet that she had for years totally disappeared. The nodules in the fingers, the rheumatoid arthritic nodules totally disappeared. The ankle pain in the right ankle disappeared. The toe curling situation, the spasms in the right foot, like a plantar fasciitis spasm, pulling those toes in, that's gone. Her neck tension, her sinus congestion, certain emotional stresses, the pain helmet, as she described, gone. The lymph armpit situation, it's just gone. It just disappeared. When we can find the hidden disease-causing infections and toxins that other laboratories miss, other types of examinations miss, when we can find these different disease-causing infections and toxins in the specific tissues they're located, as I presented to you a few minutes ago from our first exam, when we can find them and provide safe and highly effective quantum energized formulas to neutralize those different infections and toxins out of those tissues and give the tissue a chance to start functioning better than it was before, because it was so bogged down with the chemicals and infections that were living and absorbed into that tissue, that organ, the brain, the kidney, the heart, the thyroid, the stomach, the lymph, can start to work better and provide the person the normal function that they lost years ago. And I've got many different videos. Before I tell you the next exam findings, I've got many different videos. Congestive heart failure, better. Lupus symptoms, people are better. Eczema, gone. Asthma, gone. Nerve pains, gone. Migraines of over 40 years, gone. And the list goes on. In her second examination in February of 2022, her liver, I found from the rusty pipes that had been in a place where she lived before, maybe it was from a school she went to as a kid, drinking out of a water fountain, it could be from anywhere, rusty pipe materials that were stressing her liver. The liver is part of digestion. It's part of helping your intestines work. It's part of helping your blood pressure regulation system. It's part of helping your hormone balance. It's part of helping bile acid production. It's part of detoxification. The liver was loaded with rusty deposits from rusty pipes. The right kidney was loaded with mold from, I believe, from the drinking water from years ago. She had multiple mold toxins and other molds in the right kidney. She had several samples of candida that I found in her kidneys. She had candida in the blood. She had ochre toxin, a mold toxin, in her whole lymph system. She had multiple other mycotoxins still in the lymph system. She had stress in her frontal brain, the frontal lobe, from the tetanus shot, from the MMR vaccine, from the DPT vaccine. She had also, in the lymph system, it was loaded with residues from certain medications she had taken in the past, aspirin, Tylenol, in the lymph system. She had tuberculosis residues from the TB vaccine, stressing her whole lymph system. The synovial fluid in the joints, I found mold and mold toxins. I could show you right now, there's an article. When I took immunology in my postgraduate studies, I took neurology, immunology, brain dissection, endocrinology, thyroid disease, developmental disorders, movement disorders, and blood chemistry analysis. And in the immunology program, the immunologist, who's over 40 years in the industry, PhD, doctor, brilliant, he shared with us dozens and dozens and dozens of papers from research labs around the world where these scientists were not paid by drug companies. They were looking for causes of disease, not for the drug to be the answer. And I'll show you this example right now. Rheumatoid arthritis, they took samples of the synovial fluid of these patients, which I'm not going to do, and I didn't do with her. We have a unique system. You can learn more about that. I'll tell you in the end of this video how you can learn more about what I'm doing and how I'm doing what I'm doing to find these answers to give people amazing relief, like Elizabeth has shared with you. But they showed that rheumatoid arthritis, they came to the conclusion it was from parasitic infection that was in the joints that made the joints swell, the same parasitic infection they found in the person's gums, multiple people, the same parasites are in the arteries. Conclusive statement at the end of this paper, the parasites that were in the gums, we're not talking worms, we're talking tiny microscopic organisms in the gums, were in the joints, were in the arteries, causing the rheumatoid arthritis and causing artery hardening, arteriosclerosis. I found, as I said before, molds and mold toxins in the synovial fluid. She had influenza stressing her lungs. And I also found what's called Brucella bacteria in all of her connective tissues. She followed that protocol. She came back to me a few months later, driving an hour and a half down to see me just to report in that video she did with me, which you'll see again in just a few moments here, to report to me the whole lymph pain is gone, the rheumatoid arthritis pain is gone, the nodules are gone, the cold hands and feet are gone, she's feeling great, the pain helmet that she had for years is gone. Night and day for her. And it can happen for you too, whether it takes 1, 2, 3, 4, 5 visits. That's impossible for me to predict, but it can happen. It happened for her, it can happen for you, and the results can be sustained for many years to come. That's outside of saying if you picked up some infection from somebody else. I mean, there are germs on this planet that it can sometimes be hard to get away from. People can cough and sneeze, and sometimes there's things in foods that can stress people. So just understand, there's still a toxic and possibly infected planet, mosquitoes, transfer organisms. We can talk more about that later. But this is about getting you impressive results, rapid restoration of your health, and having those results sustained for years to come. That is the goal for everybody who comes to my clinic with me and them. The only thing I don't know is what is your puzzle that's causing your condition. All right, and what do I mean? If I give you an analogy here, if you went to a hobby store and picked up a Statue of Liberty puzzle, you found a box that's from the ABC Puzzle Company. It's a 3-foot by 5-foot picture of the Statue of Liberty. You love it. You want to put it together. You found that 3-foot by 5-foot picture of the Statue of Liberty is the puzzle is only 10 pieces, big pieces, 10 pieces you put together. You create the 3-foot by 5-foot puzzle. You look at another box in the same section in that hobby store, and there's the same picture on another puzzle box by the XYZ company. And this XYZ company, same picture, 3-foot by 5-foot, identical picture on the cover of the box to the ABC company, yet the XYZ company is 500 pieces. It's going to take you a lot longer to put together the 500 pieces than the 10 pieces. And what I mean is, you, like Elizabeth or any other patient, if you look at the videos on my website as well as on my YouTube channel, you can see that there are people with similar symptoms, yet they have different disease-causing infections that made the same symptom, different disease-causing toxins in their body that made the same symptom. So we've got to look at you as an individual. It's not about treating your disease. It's about finding in you what's causing your disease and your symptoms and helping you safely and effectively and efficiently eliminate those from your body, from the tissues that are hurting your body, and then you can restore your health and you get better. You're the one who's going to heal your body with some assistance that we can provide you. I was telling you before that there's certain parts of my exam process that you can become better, more familiar with, so you understand what's the difference here, as opposed to doctors you've been to in the past who told you that there's no way for you to get better, who told you that they can't find anything in your laboratories that they ran on you, who told you that you just have to live with it, or told you that it's all in your head, or told you it's just normal, or not normal, common, that people live with these different symptoms, and basically do your best, take a med and deal with it. Go take a vacation, go meditate, go try to exercise, and you're in pain. And so on my website, I have a specific video that's about 42 minutes in length. I go through in about the first 20 minutes or so about my journey as a physician into getting into this work that I'm doing now, the technology I'm using now. I share with you a basic kind of overview, a highlighted understanding of the kind of, I'll say a brief intro to the kind of exam that I'm doing. I don't get into the greatest details, so for some people it's pretty overwhelming. Some people I talk to, they have terrible brain fog, they have focus problems, they have concentration problems, they can't understand too much for too long, they can't focus too long. So I try to make it just highlights without getting too deep into that. During a great discussion that we can have, a pre-examination diagnostic consultation, we can talk about your condition. We'll take records that you can provide me of your laboratories, of any notes from other doctors, MRIs, x-rays, and certain bit of studies that were done on you. I'd like to see those as well, and we can understand from a whole nother point of view. You know, Steve Jobs said years ago, think different. We have to step out of the box. We have to be able to step out of the conventional way of thinking about a disease pattern, a disease in a person, or symptoms in a person, and look at it from a whole different way. And that's what I'm here to do with you and for you and or your family members, your friends, any of your loved ones. And back to how I do what I do. There's a video, as I mentioned a few minutes ago, that you can find. Here's the free offer. Go on my website and download your free copy to my ebook about how you can reverse supposed incurable, according to medicine, incurable diseases with quantum energized medicine protocols. It's only 40 pages. It's free for you to download. Go to the website, enter your information. Immediately you can download it. Immediately you can start reading it. It's very easy to follow. It's got very big font on the pages. It's got very big pictures on the pages, so it's not too much reading, and it will help you to start to see your possibility of healing in a whole different way. Think different. Okay. And so in that book, I've got 3 different links. One link will take you to the food page, one to the dental exam page, and one to that video that I told you about that's 42 minutes where I describe myself and my work. And then also I highly recommend you click on a link that we'll put here that you can go and read about the emotional page. Not everybody's depressed coming here, not everybody's anxious, but they have certain emotional scars, traumas that happened in their lives where those traumas had ignited dormant viruses. It's been proven in epigenetics research. It's known and proven in epigenetics research that these viruses that are part of our DNA can turn on from an emotional trauma, an emotional stress. A dog died, your cat died, a horse that you owned, who you know for your whole life, the horse passed away, and you were just left with this terrible negative, depression, pain from losing your pet who was your loved one, or losing a friend, or losing a child, or losing a parent. And so even these emotional scars can leave such a load of stress on the body that woke up dormant viruses that were already in part of your DNA in your virome. And so I found a way to figure that out and help you to neutralize those viruses and help your body recover and erase those negative emotions and erase the pain. So look at that page as well. Fortunately, I can help you have a much better chance of you getting better from your chronic disease. Unfortunately, insurance companies don't recognize this work. They just don't recognize this. So there's nothing I can do about the insurance company not recognizing my work, but I can provide you a pretty affordable way of helping you overcome your chronic condition. So whether it takes 1 or 2 or 3 visits or 4, there's no way for me to predict it, no way for you to predict it. We can hope that you're going to get better in 1 visit. That's what I want. Yet I expect you to get better. I just don't know if it's going to be 1 or 2 or 3 or so treatments, because there's just no way to know how many pieces of the puzzle you have in your body that are causing your condition. I do look forward to helping you. You can call my clinic at 954-370-3100. That's 954-370-3100. You speak to my lovely scheduling assistant. She'll be very happy to answer questions. By the way, we have a frequently asked questions page, the most common questions that people ask. It's all on my website, very transparent about everything, FAQ page. You can look at those before you even take the time to speak to my assistant. Again, you can call my clinic, or you can email my clinic. We'll put that email address right up here as well. Pause the video, write that down, and you can get started, get on your journey, and hopefully it's going to be really rapid restoration of your health. Get on your journey to get your life back. I look forward to helping you. See you soon. Hello. If you suffer from chronic pain, if it's even called rheumatoid arthritis pain, I think you really deserve to listen to what our great patient, can I say your first name?
Sure.
Elizabeth has to share with you. She's had an incredible reduction in the pain that she suffered from for a pretty long time with our care. I'll tell you right now, when you get rid of the causes, you can have a reduction in the pain in your body as well. So you started with me, it was back in, I think it was September of 21.
Yep.
Yeah. And today is now August of 22, August 24th of 2022. Your first protocol was in September of 21, and your second protocol that you completed recently was in February of 22. One of your symptoms, you had Crohn's type of symptoms, right?
Yes.
And you had rheumatoid arthritis
Yes.
pain. You also had other type of arthritis pain.
Yes.
And that arthritis pain was throughout the whole body?
Yes.
Okay. And you also had nodules in your hands?
Yes.
RA nodules in your fingers and
Yeah.
so on? We'll talk about the reduction of that. I just want to go through a list of the symptoms first. You live in South Florida, sunny South Florida, and you had cold hands and cold feet, even in the warm weather, right?
Yes.
And you had also your toes of your right foot, they would curl in.
Yeah, they would curl
uncontrollably.
in.
Yeah. You also had sinus congestion that was
Yeah.
on a regular basis, right? You had a pain in your head that you called a pain helmet.
Pain helmet.
Pain helmet. And there was also a severe type of armpit lymphatic pain that you noticed
Yes.
you had, right? And that was
Yes.
going on for a few years?
Many years, and
years.
it got worse over the years.
Over the years. Before we get into the detail of each individual symptom that we just listed of the reduction, you were describing to me before we just got on camera, you said that like the way you're feeling now compared to what it was before you started with me is what?
Like night and day.
Night and day. And that's a good thing.
Yes.
Okay. So the severity of the RA pain that you had in your body and in your hands, 0 to 10, if 10 is the worst, what would you rate it before you started with me with the RA pain?
Probably at an 8.
And now, what would you call it?
I honestly don't think I have RA arthritis pain anymore.
And the nodules in the fingers,
The nodules are gone.
they disappeared
Yeah.
completely. The cold hands and cold feet, that was going on throughout the year?
Yeah.
Okay. And how many years did you have that for?
Really my whole life, but
Well, like even since like childhood?
yeah,
Or, okay.
but severely in the last few years. Just cold feet all the time. I couldn't even get them warm with a heating pad.
And now?
And now it's fine.
There's fine, meaning there is no more cold.
There's no more.
The cold feet.
And
come.
if they're cold, it's just a regular normal cold, and because it's cold in the room, not because I'm
Not because you're cold,
cold inside,
even in
yeah.
warm weather.
yeah.
But it was cold even in warm weather. You
Yes.
could be outside in the sun
Yeah.
and still feel your cold feet, right?
Yep.
So, but now when you said cold, it could be like 70 something degrees in the house and then your feet could be cold.
Yeah, because I'm like on the
That's
tile
normal,
and there's
sure.
a chill.
Okay. The toe curling in that you had,
That's
and that was
completely
involuntary.
gone.
You would just like get up out of bed or
That
something?
came out of nowhere, and it's completely gone now.
Awesome. The sinus congestion you had daily.
Yeah, that is reduced by half, I'd say.
Okay. Half in the severity of it?
Yeah.
Or half, and what about the frequency? Is that half or is that even less frequent?
I would say, yeah, it's less frequent. Yeah.
Pain helmet, because you had the neck pain that advanced into around
Yeah.
your front of your head.
Yeah.
And that was around the whole.
The whole
around the
skull.
whole skull.
Yeah. And
How
that's
sev-
gone.
How severe was that?
Like an 8.
Like an 8? And how often was that?
Almost every day.
Almost every day?
Yeah.
Even at night too?
Yeah.
Yeah. And now it's
And I haven't felt that.
100% gone,
Yeah.
the head pain. How long has that been gone for now?
6 months?
6 months.
Yeah.
And it hasn't returned?
No.
Pretty amazing.
Yeah.
Pretty amazing. The other symptom that I wanted to discuss that you've had the amazing revelation, the amazing experience, was that armpit lymph
Yeah.
pain, and you even had a bit of a swelling that occurred underneath
Yeah.
there. So if you can describe that some?
I had this lymph pain on my left side, significantly on my
And
left
this was
side.
right underneath the breast.
Right
armpit
underneath
area.
the breast armpit area for years, more than 5 years, maybe 10 years. And over the past year or two, it's gotten significantly worse, and just lots of pain every single day. The massage and dry brushing and other remedies would only do so much. It would only halfway work. But then when I took one of my remedies, I had it was like everything in that area came together into a mass, and I felt the mass, and I was worried about the mass, and then I went in to my intuition, which is what I do with my body, and my intuition spoke to me about energy that I was carrying involving my mother's breast cancer on the same side when I was a teenager. And I went through my emotions about it, and I solved it within myself, and I immediately felt the need to use the bathroom. And I had a lymphatic
Say a drainage detoxing happening
through a bowel movement. And the mass was gone instantly. And it hasn't been back since. I have not had pain. Nope.
It's gone.
Gone.
Pretty incredible.
Yep. And that
What a
was in
release.
June.
Do you mind if I was to, when I can create another video that I can merge with this, where I describe the exam findings that we discovered that
Okay.
you took the remedies for?
Yeah, that's
okay
fine.
with you? So that one that she's talking about was her lymph was loaded that particular day, that particular remedy, that was, her lymph was loaded with a large amount of mycotoxins, specifically ochre toxin, which is a mold toxin, was caught up for quite some time, I'm assuming, caught up for quite some time in your lymphatic system.
Yeah.
I mean, you took that particular, we'll call it now a quantum energized formula. When you took that one, it just built up and you were able to flush that.
Absolutely.
Pretty incredible. Again, we're night and day compared to what you were before you came in here.